Welcome back to Drugs and Behavior with Dr. Goodin. Next is Chapter 13, Depressants and Inhalants. Depressants help the body relax. Non-alcoholic, non-opioid depressant drugs are called sedative hypnotics because they calm us down and produce sleep. Anti-anxiety drugs are often referred to as tranquilizers because of their ability to make us feel peaceful and tranquil and provide specific relief from stress and anxiety without sedating us. Inhalants are a group of chemicals that emit breathable vapors and produce intoxicating effects. Barbituric acid was developed from urea and an apple extract called malonic acid. It would set the stage for barbiturates. Barbituric acid itself has no behavioral effects, but when additional molecular groups combine with the acid, depressant effects are observed. The first true barbiturates were marketed in 1903 under the name Veronal. Many others would follow. All barbiturates are relatively tasteless and odorless and can induce sleep. They are often used in the treatment of seizure disorders because they slow down neural activity in the central nervous system. Barbiturates can last for a very short time, but usually last up to 120 hours, depending on the barbiturate used and the person. In very low doses, oral administration of the barbiturate results in relaxation and a sense of euphoria due to the disinhibition of the cerebral cortex, in which normally inhibitory influences from the cortex are reduced. As the dose level increases, lower regions of the brain concerned with general arousal become affected and may cause sedation and drowsiness. Note that the word hypnotic in this sense means sleep-inducing. Therefore, barbiturates have been used in the treatment of insomnia. Barbiturates suppress rapid eye movement sleep, which represents dreaming and general relaxation of the body. If the body goes without REM sleep for many nights, the CNS will attempt to catch up in what is called the REM sleep rebound effect, producing vivid and upsetting nightmares, along with the barbiturate hangover the next day, during which the user feels groggy and out of sorts. The most serious acute risk of a barbiturate use is the possibility of a lethal overdose by taking too high a dose or taking the drug in combination with alcohol. Use of barbiturates as sleep medications often initiates a cycle of behavior that can lead to dependence. It may cause a person to feel groggy the next morning and begin a cycle of stimulant use during the day and barbiturate use at night, or depressant use. Withdrawal symptoms indicate a strong physical dependence on the drug involving tremors, nausea and vomiting, intense perspiration, general confusion, convulsions, hallucinations, high fever, and increased heart rate. Barbiturate withdrawal is very dangerous and life-threatening. Barbiturates are still used to treat epileptic seizures. Barbiturate abuse reached its peak in the 1950s and 60s, but declined due to the unavailability of prescription drugs and stricter controls. 7% of high school seniors have tried them. Non-barbiturate sedative hypnotics include chloral hydrate, which was used for insomnia and did not produce the REM sleep rebound effect or the barbiturate hangover, but was irritable to the stomach and highly reactive when combined with alcohol. It was slipped into drinks of an unsuspecting sailor who would find himself on a boat to China. Methaqualone, commonly known as Ludes, became popular to treat insomnia until it was changed to a Schedule I controlled substance. It can be used as a date rape drug. The first anti-anxiety drug to be developed was meprobamate, which help decrease anxiety but diminish motor reflexes and increase drowsiness even at dose levels. It causes physical and psychological dependence at twice the normal recommended daily dose. Benzodiazepines specifically target anxiety with tranquilizing effects. Librium and Valium were among the first, some with faster responses and more potency. Benzodiazepines, also called benzos, are absorbed relatively slowly into the bloodstream, so they have a relaxing effect that develops more gradually and lasts longer than other barbiturates. They are safer than barbiturates and other drugs because they do not affect the respiratory centers in the brain, and it is rare for a person to die of respiratory failure from overdose. There's longer elimination time in elderly patients. Long-term use is not recommended for elderly as it produces a drug-induced dementia due to the slow elimination time. There are psychological and physiological implications of dependence on benzodiazepines. During withdrawal, signs may include anxiety levels increasing, insomnia, restlessness, and agitation. They act primarily on GABA, which normally exerts an inhibitory effect on the nervous system. They increase the actions of GABA. Benzodiazepines are not usually used alone, but are often abused with alcohol or other drugs. The greatest concern with benzodiazepines historically is that too many prescriptions were being written. Valium was among the most frequently prescribed drugs of any type. Benzodiazepines have declined substantially in psychiatric practice as newer approaches to anxiety disorders have been pursued. They may result in cognitive impairment of the elderly when combined with alcohol. They can result in long-term dependence. Rohypnol is an example that has been used as a date rape drug. Non-benzodiazepine depressants provide better opportunities to treat sleep disorders and anxiety. One example is beta blockers. Ambien works on GABA and helps with insomnia, while Lunesta lasts longer and is helpful for people who have trouble staying asleep or falling asleep. Buspar helps relieve anxiety but has no cross-tolerance effects when combined with alcohol or other depressants, and no withdrawal symptoms when discontinued after chronic use. It has few side effects and does not impair motor skills. It works on serotonin rather than GABA. There is a very long delay before anxiety relief is felt, which means it is unlikely to be used for acute anxiety conditions. Beta blockers slow the heart rate, relax pressure on the walls of blood vessels, and decrease the force of heart contractions, and are often used for individuals with stage fright or performance anxiety. Antidepressants are often used for panic disorder, PTSD, and social anxiety disorder. GHB is a CNS depressant produced naturally in the body in very small amounts, but has been found to induce seizures and comas. It is abused to produce euphoria and an out-of-body high, in conjunction with the lowering of inhibitions. When combined with alcohol, it can lead to unconsciousness in about 15 minutes and result in subsequent amnesia about the experience. It can be used as a date rape drug because it is colorless, tasteless, and odorless. Before I start this slide, I want to mention that there are strategies for women to protect themselves from being roofied or given a date rape drug that involve paying close attention to one's beverage or even testing the drink with drink-safe technology. It is good to drink with a friend who will protect you. Mind-altering effects of substances inhaled into the lungs have been known since the beginnings of recorded history. The two most prominent cases to evolve were nitrous oxide and ether, both used as surgical and analgesics in the 1840s, but had recreational possibilities. Nitrous oxide is also laughing gas and can serve as a non-alcoholic avenue to drunkenness. Dentists realized its usefulness for their careers in that it helps people feel no pain. Nitrous oxide can be contained in tanks or small cartridges and is used recreationally at parties or on college campuses, often inhaled from a balloon, resulting in a mild euphoric high lasting for a few minutes and a sense of well-being that lingers for several hours. There may be a loss of consciousness for a few seconds and an experience of flying, sensory distortions, nausea, or vomiting as well. Nitrous oxide is a propelling gas in cream canisters and other similar devices, so it is readily available. It is very dangerous while driving. It is not combined with oxygen. If it is not combined with oxygen, it can be lethal. Ether was used for intestinal cramps, toothaches, and other pains, and produced a drunkenness effect. It became popular during Prohibition times, but was dangerous due to its flammability. Recent use of inhalants often includes glue and solvent chemicals, such as paint thinners, lighter fluid, and stain removers, as well as many aerosol products that are inhalable, such as hairsprays, deodorants, vegetable lubricants for cocaine, and spray paints. Exposure of pregnant mothers represents a 13 times greater risk of birth defects. They provide rapid intoxication and are readily available. They inhibit the CNS after they are inhaled and produce giddiness, euphoria, dizziness, and slurred speech lasting from 15 to 45 minutes, followed by 1 to 2 hours of drowsiness and sometimes a loss of consciousness. They may produce double vision, ringing in the ears, and hallucinations. Inhalant abuse involves concentrations of glue and solvent products 50 to 100 times greater than what is used in the industry. The toxic effects combine with intoxication feelings of euphoria and omnipotence and recklessness. Some produce hallucinations and delusions that can lead to impulsive and potentially destructive behavior. There is a risk of choking and asphyxiation. With Freon, its coldness can be a risk for freezing the throat upon contact. In particular, propane and butane are very dangerous, as are other inhalants such as acetone, which damages the mucous membranes, benzene, which may cause leukemia or anemia, hexane, which causes peripheral nerve damage, toluene, which causes a short-term memory loss, anemia, and loss of hearing, and gasoline, which is associated with spastic muscle disorders and liver problems. The lead in gasoline is generally linked to long-term central nervous system degeneration, but it is no longer readily available. Inhalants are often the first psychoactive drug someone will try even before alcohol or tobacco, as early as age 11 or 13. 13% of 8th graders had used inhalants at some previous time. It may be referred to as huffing. Those at greatest risk for abuse of inhalants are the poor, the rural, and minorities, primarily focusing on low socioeconomic status. Peer influence is a major issue. It is often used to avoid pain, confusion, or to get away. Inhalant dependence occurs frequently, but there is a lack of research on its long-term consequences, besides feelings of restlessness, irritability, and anxiety during withdrawal. There have been restrictions to the availability and sale of glues and other items to young people. Others have used aversive additives such as oil of mustard, which irritates the nasal passageways. I will see you in Chapter 14.